language, but we learned the language for
Or you can speak China.
Yes, of course, I speak very well.
How are you? How are you in China? Eh?
Ni hao, ma.
Okay.
No, it's actually quite
Ni hao, ma.
Yeah, ni hao, but you cannot answer with no hen hao. That's fine. Wo hen hao.
Hello guys, welcome back to my YouTube channel. Here with me is a very good friend of mine and my colleague in medical line, Dr. Lovable. Well, before I continue, I would like her to introduce herself because you all know who I am already.
Alright, so my name is Dr. Blessing. My AK is Dr. Lovable. Anyway, you see me, call me Dr. Lovable. I'm sorry.
Alright, Dr. Lovable. She has a YouTube channel. You might want to subscribe to her YouTube channel maybe sometime later. Okay, yes. So today it might interest you to know that my good friend here did not study in Nigeria. She studied in China. Drums roll. Okay, so we want to, I know that you might be curious. Immediately I said China, the first thing that will come to your mind, wow, why China? And she's here to answer all your questions, okay? So we'll start with, I have a lot of questions to ask her. Because the first time she told me that she came from China to do her house job and all, I was like, wow. I asked her a lot of questions, and that's why I decided to do this video with her, so that I can put it out there for my community so that they can also learn in case you want to go study outside the country, especially China. So the first question we have here is, why China? Because that's the question you have in your mind right now. So why China?
All right. The truth is that China wasn't my first choice.
Okay.
So, just like everybody, I had the mind to go to US, UK, Canada. So, but I discovered that their fees, was a lot. I ended up paying so much. So, and at that point, China was welcoming to international students, and their fee was almost equivalent to what you can pay for a very rich university. So, but the truth is that I really don't regret going to China. But yes, I would have actually preferred to go to the US, UK, It wasn't bad.
Wow. Okay, so how is medical school in China like?
Medical school was quite fun and nice because I feel things were made easier for us. Here in Nigeria, because I did my clinicals here in Nigeria, so here in Nigeria, you see the whole, they try their best to make things difficult. You see a very big textbook and you're expected to cover everything, but it's not like that there. So when they teach you, they still give you some areas they feel like these are more important things to know, and it helps you coordinate yourself. They don't fill your head with so much knowledge at a time. It's just gradual, it's a gradual process. Wow. So it's very nice.
So how were you able to get into medical school in China?
Okay. The process of getting into the school was difficult for me because actually I didn't even use an agent. I applied myself.
Wow.
Yes. So I had the zeal and interest in studying medicine. So I started browsing. That was how I knew that US and Canada, their fees were a lot. So when I saw the school, it's just a normal process. You see it, you click apply, you fill the form. That was just it.
Wow, and you didn't need any agents?
No, I didn't use any agents.
Wow.
I'm telling you, when I even paid my fees, my mom was scared. So this fee, hope it's not going to get missing. So, but they gave us the account number, we paid the fees, and everything was done.
Wow, that's so nice.
Yeah.
So, how many years is medicine and surgery in China? Like here in Nigeria, we study medicine and surgery for 6 years. First year to do general course, every other person is doing. Then from second, third, fourth year, we now narrow down. So, like here in Nigeria, we have years for preclinical, then for the fourth year is just for basic clinical classes where you do parts, farm, then 5 and 6 is now clinical classes, okay, where you do the clinical session of medicine.
Yes. To hospital.
Yes, we are doing theory and also going to the hospital to learn the practical aspect. So how is medicine like? Is it the same thing there, or is there any difference?
No, it's not the same thing. It's not the same thing because first is that our medicine is 5.5 years.
Okay.
So more like 5.5.
Okay.
So the first we did differentiate it into clinical and preclinical. I don't know. So, but from the first year, we did more of, let's say, GSTs of Chinese language. That was how I learned Chinese language. So we did Chinese language, then the mathematics, physics, the same thing. Then from 200 level, that was when we started anatomy and the rest. Yeah. So we kept doing our theoretical classes all through.
Wow.
So that's how it's done till your 400 level second semester. So that is when we now start what we call internship. We call it internship. So which I learned that it's called clinical electives.
Okay.
Yes. So that internship is purely you being in the hospital. No theoretical classes anymore.
Wow.
So it lasts for a year and a half. That's the 0.5.
Okay.
So then we have the option of either you do it there in China or you can do it in any country of your choice. I have friends that went to Ghana, some went to the US. And me, I decided to come back to Nigeria, my country. Yes, I wanted to learn the Nigerian way, so I decided to come back here. So when you finish that internship for that 1.5 years, there's a logbook which will be signed and everything. When you finish, you are not expected to come back and write the graduation exams. Then you graduate. So that's the way we do it.
Wow, that's so nice. So, how is the lecture over there like? Were you guys taught in English or in China?
Well, that's an English language, Joe. I can't imagine being taught in Chinese language, but we learned the language for
Or you can speak China?
Yes, of course. I speak it very well.
How are you? How are you in China?
Eh? Ni hao, huh?
Okay.
No, it's actually quite
Ni hao,
easy to
ma.
learn. Yeah, ni hao, ma. You cannot answer with wo hen hao. That's fine. Wo hen hao. Anyway,
Okay, it's okay. Wo hen hao.
So we're taught in English language.
Okay.
And anyway, there's a question that people used to ask me. They ask, do you have classes together with Chinese people? So the truth is that we don't have classes together with the Chinese because the Chinese people, they are taught in Chinese language.
Okay.
So when you come to the university like this, we have what we call the School of International Studies.
Okay.
Yes, so that part is all for foreigners. So my classmates were more of Nigerians, Ghanaians, South Africans, even Pakistanis, Indians. So every foreigner, you stay in that international school. So that was where we stayed. So we're not having classes together with the Chinese students.
So how is the exam like?
Okay, yeah. So for the exams,
My channel is all about excellence, productivity. So if I don't ask this question now,
I understand.
So okay.
Their exams actually, I heard a Nigerian do the whole MBBS.
Yes, we have. Okay, let me explain our own. Like in Nigeria, here we have first MB, we write it after 100 level, then second MB after 300 level. So we don't write any exam in 200 level. Yeah. So for our third MB, we write it after 400 level, then fourth MB after 500 level, and then final MB after 600 level. So that's how we write our exams. So how do we write for you?
For our own exams, we don't do the whole, pass. So, but it's more of we just write our exams like every other course. After 100 level, you write 100 level exam. After 200 level, 200 level exams, like that. So till that's 400 level I told you about when we start clinicals. So when you start clinicals, you don't have any exams again. Till after that clinicals, before you graduate, you now write your graduation exam. So that graduation exam is not the one that will now have the OSCE and the MCQ. But before that, every other exam is just normal MCQ and theory.
Wow. So you don't call it MBBS?
No.
Okay, so you are learning now, right? So let's talk about the textbooks you guys used. Which textbook did you use for your anatomy?
Okay, talking about textbooks, how do I put it? In China, we use textbooks that let's say, edited and rearranged by the Chinese lecturers.
Okay.
So you can have a textbook that has skeleton and all inside. You have another one that has so just differences in the make it just a bit concise.
Wow.
So
just wow.
So we don't really have all those big
getting and all and
we don't have all those big textbooks. And then aside that, every lecture they give us PowerPoints. Wow. So those PowerPoints are quite detailed. So the PowerPoint alone itself can help you cover enough. So you just use textbook for further reading and all. So
wow,
the PowerPoints are very rich.
So what's the most interesting aspect of studying in China?
Okay. I won't lie, one of the most interesting part of it is the fact that they are very good in technology.
Wow, that's
Yeah, so
even watching their movie, you really like what is
so the practicals were very, very good. Like practicals, I mean all these physiology practicals, all the things we do, all this action potential, all those things.
Yes.
We really did them very well. And then histology, is unlike we have been in a Nigeria setting where you see one student.
many students will just be viewing one slide.
Exactly. So, but in our case, one student, one microscope, and then you don't have to stress your eye to look. The screen is projected on the screen, so there's a monitor.
Wow.
So you just look at the monitor, and so it helps protect your eyes. So the technology is top notch, and I really enjoyed that. That was one thing I did not really get from Nigerian school.
Wow,
But they are very good.
So I heard that you guys hardly touch patients, like in case of palpating an abdomen, so how do you do that? How do you now learn how to handle some of those clinical experiences?
The truth is that medicine is more of practice.
Okay.
So yes, we don't really have access to physical patients because how do I put it? Chinese mostly they don't like foreigners touching them at all. So they prefer Chinese students. So if the Chinese students can easily touch the Chinese people, but not we foreigners. So that way we usually use more of these mannequins and the rest. So they have very nice ones that you can use to learn whatever you want to learn. So, but China has this idea that all those practicals and all we get better when we start practicing. So they don't want to bombard us so much with it.
And
so
you said there is a time you guys will have to come down to go to any country just for practicals and clinical.
So they didn't really stress so much on that. Just help you know, okay, this after inspection is this one, after this one is this one.
Okay.
Just more of just know it, but not be good at it.
That's very nice. That's very nice. So you are currently doing your house job here in Nigeria. So is it that they don't do house job in China, or like I want to know how after medical school in China, what's the next thing?
Okay, so just like every country, after your medical school, you write the licensing exams.
Okay.
Yeah, so for we foreigners, we didn't write the licensing exams.
Okay.
But the Chinese students will definitely write the licensing exams to start their house job.
Okay.
And most likely. So the constraint there is language.
Oh, yeah.
Their licensing exam is strictly Chinese language. Oh, yes, strictly everything, including your OSCE, everything is Chinese language. So, but the main thing is that for we foreigners, we end up after graduating, we just decide to write any other country's licensing exam. So, but for the practice for to practice medicine in China is actually a long protocol. It's quite long because you have to, for example, for us to graduate, we had to write the HSK 4. They have different grades of HSK. The same way we have your IELTS. So they have 1 to 6. So 6 is the highest. So to write that exam, you must have HSK 6, which is quite high. So most times it's just leave it. So but people who have the interest can go for it, and they have their own protocol, which is a very long protocol towards practice.
Yeah, you don't want to.
Yeah, I don't want to dive into that.
All right, thank you so much. I think we have exhausted all the questions I need to ask.
Okay.
I can't remember any other question, but then, dear community, you can ask any question you want to. Okay, we still have our doctor here with us.
Yeah,
I'll compile the question and then I'll bring her back so that she will answer them. Okay? So for now we are done, and thank you for staying till the end. Do you have anything you want to say to my wonderful community here on YouTube?
I don't know what to say, but all I have to say now is please subscribe. Like, share, keep sharing, Let's
Thank you so much. Bye.
Bye.